Hi, welcome to online platform of Eduwizz Academy. So we are going to discuss about questions which are frequently asking for the GCC country examination. So welcome once again. So first question, what is the relationship between childhood vaccines and autism? You all know that childhood vaccines which we are taking as DTaP, oral polio, right? So vaccines does not cause any autism problem. So we can select in that as none of the vaccines causes autism. You need to prefer that in some research studies they are study revealing that MMR vaccine may cause autism, but there is no strong evidence for that. Okay, so we can select the answer as none of the vaccines causes autism. Okay, so moving into the next question, what is the function of small nuclear, that is SNRAs, in protein synthesis? You all know that proteins are made up of amino acid, right? So in that process, that is ribonucleic acid, protein synthesis take place. And the protein synthesis, in that protein synthesis, translation process is there. For the translation process, the mRNA is transcoded with the ribosomal units. Okay, these ribosomal units attach with the mRNAs and then into transfer RNA, that is tRNA, and then it create the amino acid. So from my point of view, we can select as modifies mRNA molecules, right? So the answer is modifies mRNA molecules. And other options are genetic blueprint of the protein, translate genetic code to amino acid, act as a catalyst. Okay. So our answer is modifies mRNA molecules. While I am reading the question, you can guess which is the answer. Okay. And next question, patient was prescribed hypnotic anxiolytic and is to be taken before bedtime. When she wakes up, she is still drowsy. What is the most likely causative drug? So it is a direct question, right? So a patient is taking a hypnotic anxiolytic. Anxiolytic means it is given for the anxiety condition which causes hypnotic, right? She is taking in the bedtime, but in the early morning she is feeling lethargy, drowsiness and all, right? So what is the causative drug? In the given options, Ramilton may cause drowsiness, but when compared to diazepam, it will not cause that much drowsiness. So our answer is diazepam. So Ramilton, Soldepam, Solpidem, diazepam and midazolam are the options. From that we can choose that diazepam causes drowsiness. Okay, so next question. Which of the following is the first line treatment of malaria can be caused by Plasmodium falciparum in Saudi Arabia? The specific question is mentioned that in Saudi Arabia, Plasmodium falciparum is there, right? So what is the first line treatment for that? So it is a direct question. We can select that artesunate. You should study that as artesunate. Okay. So next question. Your colleagues has been contacted with Clostridium difficile patient and used disinfectant wipes. What to do? This Clostridium difficile is a colon. It is a bacteria. It is a healthy bacteria which is present in our colon. When it comes into the intestine or in other parts, it causes infection. Okay. So we need to maintain the personal hygiene first. So we can select which option. From the given option, we can select as wash hands. Okay. And our answer is wash hands. And next question, what is the ibuprofen and aspirin drug interaction? We all know that both are NSAID. NSAID mainly causing the gastric mucosal irritation. When we are giving both NSAID, it goes in the what? Gastric mucosal irritation and causes bleeding. So the answer is increase the bleeding. Okay. So other options are increased blood pressure, decreased blood pressure, increased risk of myopathy. And the next question is, which of the following is the most appropriate regimen to prevent constipation in patients starting on morphine for pain? So there is a pain cycle. So in that pain cycle, we first prefer what? Paracetamol, and then ibuprofen, and then tramadol, and last and most given drug is for cancer patient is morphine. So they can't survive with that so much pain. So we are giving with morphine. Okay. So morphine the main area of morphine is constipation. So in the option given below, these all are given for the constipation, right? So for morphine constipation, we can give it docusate and senna. Okay, you can study directly that docusate and senna are given for the morphine-induced constipation, right? So our answer is docusate and senna. And next question, which of the following genetic testing might derive a potential benefit from trastuzumab therapy in a breast cancer patient? So mainly in the breast cancer patient, there are three hormones mainly present. That is HERT, that is human epidermal growth factor 2, and estrogen receptor, and also the progesterone receptor. Okay, HER2, ER, and PR are the most likely hormones which are present for the breast cancer patients. If the HER2 is positive for a particular patient, we need to give it trastuzumab therapy, that is monoclonal antibody therapy. So we can choose that breast cancer trastuzumab, we can select directly as HER2 genotype positive. Okay. So next question is, what is the primary source used in poison control center? It's an easy question, right? Poison, from the poison which is known as toxin, we can select as toxnet, right? So our answer is toxnet. And next question is, which of the following chemotherapy is preferred in patients with lung cancer? So for the lung cancer, first line treatment is given with taxanes. If we are given with platinum compounds, it increases the actions. Okay, so we can select the first line treatment for the lung cancer is taxane. Okay, so the taxane is answer. So thank you so much for watching. So please subscribe, like, share for more updates. Thank you so much for watching.